Hospice Africa was founded with a vision for the whole of Africa, and actually it has moved very quickly, and the reason why is because we're managing pain, and that's what I've come to talk to you about today on behalf of Dr. Eddie, who is in charge of the morphine production unit at the moment in Hospice Africa, Uganda. The reason that palliative care hadn't reached Africa for many years was because the medication for severe pain was very, very expensive. And approximately 85% of patients with cancer will have very severe pain and will require opioids or similar strong analgesics. The WHO have recommended that morphine is not only the best one, but it is it's the most available and it can be the most affordable. But unfortunately, when it's manufactured in other countries, there's always a middleman that puts the price right up. And that was not affordable in African countries, mainly because of the economies. There was 2 African countries that could afford it, and that was Zimbabwe and South Africa. Zimbabwe started palliative care in 1979, followed closely by South Africa in 1980. And so they had it for 10 years when I came out to Nairobi to be their first medical director. I told them I wouldn't come unless we had affordable morphine. And we had actually made a formula for affordable morphine in Singapore, where I was working previously. So that was the first time that we brought that formula. They said, okay, and within 6 months they had the affordable morphine in Nairobi, and I came there and worked there. And then when the vision for the whole of Africa was obvious, it was something that needed to be spread throughout Africa, because now there was only 3 countries in the whole of Africa with any form of palliative care, most of it localized. It was then that we said, right, we need a model in a country that's willing to train others so that it will move throughout Africa. So that started in 1993, and now since then 35 countries are talking about palliative care, know about it. Only 15 have the affordable oral morphine, and this is mainly because governments are following the International Narcotics Control Board, which is stressing more the problem of addiction versus the need for therapeutic morphine. And this stress on addiction has really made the paranoid the governments throughout Africa, who worry that if they allow morphine in, they will be called people who help addicts to get this dose. Now, the morphine as we use it, oral affordable morphine, in the strengths we have, is not addictive at all. And we in Uganda now, just at hospice alone, we have treated 27,000 people. 25,000 of those at least have been on oral morphine. We've never had addiction or diversion of the oral affordable morphine. We actually haven't used an injection for about 15 years. And we manage the pain completely with oral affordable morphine. We must keep the price down, because if the price goes up, that is the end of palliative care in Africa. Now, when we first made it at the kitchen sink, the cost was the price of 1 loaf of bread. We did that for 17 years. And then in 2011, the government asked us to take on making morphine for the whole country from our own place within the hospice in Kampala. And when we did this, we had to form a contract with them, and we got the National Drug Authority, of course, who had always been in control of what we did. Now they insisted that we wear caps, gowns, masks, boots, a big sterile environment. We had to upgrade the whole, it's only 1 room actually, and then we got a lot of equipment from America to make more because we're making it for the whole country. Remember that Uganda is the only country where nurses can prescribe morphine, so the government pays for the morphine, and it's free to anybody that is prescribed by a recognized prescriber, and that includes the doctors. The clinical officers have been trained, and the nurses have been trained by Hospice Africa Uganda. So we use probably more morphine than most African countries per head of population. So now that we're having to use, they also insisted, we always used recycled water bottles, and that was when it was costing 1 loaf of bread, and we made the labels ourselves. Now the labels have to be printed, the bottles have to be made of glass, they're made of plastic still, but they've got to be dark, so they have to be manufactured, so all this adds to the cost. And also there's certain testing that has to be done on it, and testing, extending shelf life, making sure that the product is always right. So now it's costing at least 2 loaves of bread. And of course we have people employed to help us make it, so that also puts up the cost, whereas before just the dispenser in the pharmacy was making it. So the price has gone up to 2 loaves of bread, but it's still affordable, and the government is still paying for it for the whole country. The raw morphine, for years we were getting it from Scotland, actually, from Edinburgh. What happens is that the morphine is grown in any particular country, and then certain manufacturers are allowed to import that morphine product, and there they will test it to make sure that it's pure, and then that you can buy it from them. Now, like we do for all drugs, we have to check the prices throughout the world. Now they're actually getting it from Hungary through Kenya, through Nairobi. There's an Indian man in Kenya who imports it there, and we get it from there. Apparently because it's cheaper, and the price seems to be going down, probably because more people are using it. You know, it's now around $2,000 per kilogram, and it was about $4,000 when we started off. I understand that if we got the permission and we had the controls in place, we could actually grow it there, and that would make it even cheaper still, you know. But then we'd have to have people to make sure that it was pure and that it was refined properly and all the rest of it. And I don't know how much that would cost. But I understand from the powers that be that it is possible to grow it anywhere, as long as the International Narcotics Control Board have approved that that country can grow it. So at the moment it probably is mostly coming from Afghanistan and those areas around there, yeah. To enable countries to have it more, we need to get into the governments. Now, the governments are advised by doctors. The doctors are afraid to use it because of the story I've told you. They'd be afraid that they'll be called addicts, etc., or that they're tending to be addicts. The only way to stop doctors thinking like that, because if you're an old doctor, you don't want to learn new tricks. I don't want to learn new tricks anymore either. But for the young doctors, you have to get to the undergraduates and train them in palliative care and the use of morphine and pain control. Now, we started training the undergraduates in 1993. Now, most of our doctors know what we're talking about, and they've no problems about prescribing it. But in the other countries, it's taking a long time to get it into the undergraduate curriculum. Doctors, nurses, all health professionals need to know about it. So education is the key to getting that in. Those doctors then will be advising the government, and we will change the government policies. But it is a very difficult, it's an uphill job. We're 22 years at it, and you know, only 15 countries using the affordable morphine. It's difficult, yeah.